More and more people are living with respiratory failure and sleep-related breathing disorders. Home healthcare specialists, Vivisol, are working with the NHS to take some of the strain from the hospital clinical teams by providing specialist support for patients in their own homes, resulting in improved therapy outcomes.
Amanda Whiffin is the clinical director at Vivisol, a leading home healthcare provider that offers in-home patient visits.
Hi. Hey, Wendy, it's Amanda.
She's here to meet Wendy, a patient who suffers with obstructive sleep apnea, which is a condition where your breathing stops and starts when you sleep. Amanda's role involves supporting patients to use a CPAP machine from the comfort of their home.
I'm here today to show you your
CPAP stands for continuous positive airway pressure, and it's a therapy which enables patients like Wendy to breathe while sleeping.
So, Wendy, what I'm here today is to show you the CPAP machine. We really do want to make a difference to the patients. We have a professional team of clinicians and physiologists who really can make that difference. How does that feel? Does it feel comfortable? Good.
Wendy Gilchrist had recently been diagnosed, but since having visits from Vivisol's qualified clinicians, she has been able to use her device, which has seen her apnea-hypopnea index, also known as AHI, improve dramatically, as it indicates the severity of her condition. Wendy is optimistic about the future.
I'm looking forward to having a proper night's sleep, not being woken up, not my brain telling me to wake up because I've stopped breathing, and to be able to live a normal life like my niece who was diagnosed 10 years ago, and after 10 years of treatment she's fine. You know, she gets on with her life, and it'd just be nice to be able to sit and watch a TV, go out, take the dogs out, go for a drink, just do anything than sit and sleep.
Not only are Vivisol providing support to those who are diagnosed with obstructive sleep apnea, but they also provide 24-hour patient access to support lines. This couldn't be more helpful for consultants such as Dr. Michael Ocko, who is a sleep apnea specialist and runs his own sleep service in Lincolnshire.
Well, we do know that when we were running clinics historically, face-to-face in the outpatients department, they explain everything to the patient, but you're not sure how much they actually remember by the time they get home. So actually having a home set up, they can do things like know how far the plug is away from your bed. You get time to explain on a one-to-one basis how the device actually works. And this helps everybody, so you get that one-to-one personalised gold standard care at home.
Michael believes that through Vivisol services, patients have saved time coming in personally to see him to check on their progress. And this also helps to reduce the carbon footprint for the NHS.
It restores people's quality of life back to normal. So one of the most rewarding areas to be in medicine, because you're giving people back their sleep. And sleep is the best medicine.
It's a sentiment shared by Managing Director at Vivisol, Stephen Cotty, whose team has helped consultants like Michael deliver effective in-home healthcare services.
We receive prescriptions from clinicians like Mike, and he could be asking us to go and do a diagnostic study on a patient, in which case we send the right equipment out to the patient, we do the study, send the information back to him. Or it could be that the patient needs to go on to therapy, in which case we go out and we install the device, get the patient set up nicely and ensure that they're then compliant with their therapy moving forwards. By working closely with the NHS, we can help where it's needed to remove administrative works, and this allows the clinical teams in the NHS to focus on their role, looking after more complex patients.
The company are geared up to ensure that people can be treated at home in a way that leads to successful outcomes in their therapy.
We've got a wonderful team of very committed, very passionate and very caring individuals. And at the moment we're providing services for a number of trusts, but the opportunity is enormous. We know that patients enjoy being treated in their own home, and we're looking forward to rolling this out across the country.
And it certainly has made a difference to patients like Wendy, whose AHI has improved significantly from 99 events per hour to just 1, and who have been given the vital in-home support they need.